Local 4 News starts now with a breaking news alert.
I've not seen anything like this.
152 Detroit police officers are now in quarantine after 5 test positive for coronavirus.
And it's the last news students, teachers, and parents wanted to hear. Michigan is not counting online schoolwork, so right now kids are stuck in a kind of limbo.
Protect those around you. Every hand wash and every person who stays 6 feet from their peers could mean one less day of this crisis.
But first, Governor Whitmer on where things stand here in the state of Michigan. 549 confirmed cases. When the week started, there were only reporting a few dozen.
We just learned the governor has signed an executive order to ban evictions, also banning non-essential medical and dental procedures, non-essential procedures. Whitmer is also taking steps to stop price gouging, to keep people from making money off this crisis. We reported on some horrendous examples of that. And just moments ago, the governor spoke on possibly ordering families to shelter in place.
Not having plans to do something right now doesn't mean at some point we might have to take more aggressive action.
So the governor says for now, Michigan just not there yet. But her message was clear. We're in this together if we all do our part.
Michigan school leaders dropped a bombshell on students, teachers, and parents today.
The online work that many of them have already started, working from home, is not going to count toward the curriculum. This evening, there are fears that some kids could be held back or worse. Paula Tutman joins us live in Rochester Hills. Interesting, Paula, that the governor herself just a few minutes ago said she was surprised to see that announcement earlier today.
Well, it's probably because she hasn't been watching our news, because we've been indicating this really since last week. Because by law in Michigan, every child has to have access to, and that's just not the case for remote learning. But this is where you cue the dominoes, because most teachers you talk to, they love what they do. It is a passion, but it is a job and their livelihood, and this creates problems for them as well. Without question, despite incredible challenges, teachers throughout the metro area have been working on ways to educate their students remotely.
And this is what they would see if they were in front of me every day anyway.
Today, clarification from the Michigan Department of Education indicating that short of legislative action, as of today, the lessons and the work will not count academically. And the statutory 180 days of learning will remain intact, which means these days will have to be made up. While the CDC has given guidance that schools should remain closed for more than 3 weeks, thus far, Governor Whitmer says she's hopeful students will return after April 6th. But if students don't, the days will have to be made up on the back end of their return, which means Michigan's teachers will need additional pay or their contracts are being violated.
For our members, what it means is that there's a possibility of having contractual issues. If they're being required by their school districts to report, whether virtually or remotely, that they are in fact being told to work by their superintendents and by their school districts. If in fact these days can't be made up and can't be used and need to be made up, then we have contractual limits to the amount of days that educators are supposed to be working in the schools based on their individual contracts. We could be in violation of contracts, extra pay. It could cause extra pay to be needed, all of those things.
Also, a school extension could create hardships for teachers who often work other jobs in the summer.
If this goes beyond April 6th, if we follow the lead of other states where they're closing school for the rest of the year, we're going to have a serious problem and policy discussion that needs to take place.
Okay, cue a little bit more confusion because lawmakers get back to work on Wednesday. And by law, they could actually change the statute so that kids could possibly get graded for their work, or so that they don't need those 180 days of learning. But we won't know until they get back to work. So whatever we say today, understand that's what we know today, but it really could change tomorrow or next week, guys. I just want to be really clear about that.
As with so many other walks of life at the moment, it's moment to moment. All right, Paula.
All right, now to breaking news we told you about at the beginning of this newscast. 152 Detroit police officers are now in quarantine.
That comes after 5 officers tested positive for coronavirus. Let's get to Mara McDonald live from outside Detroit Police Headquarters. Mara, along with concerns for those officers who've tested positive, I think people are wondering how much this is going to impact the department's ability to do their work.
Well, right now, the chief says, Devin, that they are managing rather well. However, that can all change if they have another spike in cases. The chief addressed the whole issue. Take a listen. The chief says the first quarantine started on the 9th of this month, and while there are 152 in quarantine currently, a number of them will be coming out of quarantine shortly.
We're anticipating that a number of our members, where we had that largest jump, are set and due to go off quarantine as early as today. That has not happened yet.
But depending on how much further the virus spreads into the department, different measures are going to have to be taken.
Right now, we are managing well. If that number were to double, I would become certainly increasingly concerned, and then I would have to go in the next phase of deployment.
The chief has told officers their discretion is such that they cannot worry about low-level misdemeanors at this point, but felonies or sexual assault cases and domestic violence cases are still high priority.
There are no disruptions to service. Long-term, depending on what we see over the next couple of days, I may make other modifications.
Back here live, some of those modifications so far. The coronavirus really hit the 9th precinct pretty hard, according to the chief. They've had to backfill officers there. They are moving people around as needed. Right now, business continues. We're live at Detroit Police Headquarters. I'm Mara McDonald. Back to you.
Incredible. Okay, Mara, thank you.
You mentioned the growth of the exponential nature of it, which we've expected, but think back, Sunday night we reported 45 confirmed coronavirus cases in Michigan.
And this afternoon, now we're confirming 549 cases. The numbers have skyrocketed all week, and that trend is sure to continue. That's why hospitals in Metro Detroit are preparing for more and more patients. Sean Lay joins us live outside Ascension Southfield, just one of the many hospitals working out of tents. Sean.
And working hard to keep people inside the hospital, patients already here, and their hardworking staff safe. So Ascension today putting blue tents outside their emergency room system-wide, meaning if you're coming here with coronavirus type symptoms, you're not going to be able to walk into the emergency room. You're going to that tent to be screened first. This is the new normal for now. Triage areas now set up outside of every Ascension, Michigan hospital like this one in Southfield. You'll see the same triage tents at Ascension locations in Madison Heights, Ascension St. John, Ascension Providence Rochester, and their location in Novi. This is part of the hospital's emergency preparedness protocol. The goal, to distance people who think they've been exposed to coronavirus from the rest of the patient population, from the staff, and from healthcare workers. Ascension doctor Sean J. Ocker says the triage tents outside are key to keeping people safe inside.
I think it's a really good idea so that we don't have our ERs inundated with people with COVID-19, and they will spread the virus to more people and we'll have more infections. So it's good that we have a system in place where we can triage these people, and the ones who need to be hospitalized will be hospitalized. And those who simply need instructions will be given the instructions, and then they can go home.
That means if you feel that you have coronavirus symptoms, call your doctor first. And before you set foot inside a hospital, you'll be first checked out inside one of these triage areas. We saw the same thing at McLaren hospitals here. No one is allowed to walk into the emergency room without being checked for COVID-19 symptoms first. It's all about treating people, but stopping the spread. Again, bottom line, if you're coming here after talking to your doctor with those symptoms, you're going to be screened in a tent, much like many other hospitals in the area. And there's a good likelihood you may be tested and then even sent home waiting for the results of those tests. I'm told people who are very sick will be taken to an isolated room. We're live tonight in Southfield. Sean Lay, Local 4.
Yeah. All right, Sean. Now let's get to some breaking news just in as Illinois becomes the latest state to take dramatic action to try to prevent the spread of the virus.
At least 3 states are now ordering people to stay home, with the end dates really just up in the air. Cases in the U.S. now top 14,000. NBC's Sarah Doloff has more from Chicago.
Kimberly and Devin, good evening. These dramatic measures come as government officials see other countries like Italy and Spain buckle under an influx of patients.
Tonight, the governor of Illinois issuing a stay-at-home order effective tomorrow, joining California and its 40 million residents sheltering in place.
We need to bend the curve in the state of California.
On the opposite coast, New York stopping just short of a lockdown. The governor ordering all but essential workers to stay home.
This is not life as usual. And accept it and realize it and deal with it.
President Trump under pressure, saying he's beginning to use the Defense Production Act to direct companies to make critical supplies.
We have millions of masks which are coming and which will be distributed to the states. The states are having a hard time getting them, so we're using the act.
The president and the nation's top infectious disease expert offering different levels of confidence in the effectiveness of a malaria drug some believe can treat coronavirus.
I feel good about it. That's all it is, just a feeling.
You're also collecting data that will ultimately show that it is truly effective and safe under the conditions of COVID-19.
Meanwhile, on Capitol Hill, leaders of both parties showing signs of cooperating across party lines. Working to buy struggling Americans time, the White House extending tax day to July 15th and sealing off the U.S.-Mexico border to all but essential travel and trade, just like it did with Canada. A roller coaster day on Wall Street, capping off a brutal week with the last day for the foreseeable future of trading on the iconic floor of the New York Stock Exchange. Activity going online beginning Monday. And a first look at unemployment numbers already showing signs of climbing, as millions are ordered not to work but to stay home. A tough, but officials say life-saving pill to swallow.
Epidemic expert Dr. Anthony Fauci says it's likely Americans will have to stay at home and continue to practice social distancing for several more weeks. In Chicago, I'm Sarah Dolph, Local 4.
All right, Sarah, now to the end of another volatile week on Wall Street. Stocks sank to their worst week since the financial crisis of 2008. Dow dropping more than 900 points on the day, ending the week at a 17% loss. The S&P 500 and the NASDAQ both fell down 4% on the week.